Good morning, dear Dr. Ramsay. Good evening, friends from Nepal, Bangladesh, Georgia, Algeria, and good morning, friends from U.S.A. I welcome all participants to this international webinar organized by Department of Veterinary Clinical Medicine, Ethics and Jurisprudence, Nagpur Veterinary College, Nagpur, which is the constituent college of Maharashtra Animal and Fishery Sciences University, Nagpur, Maharashtra, India. Today I am extremely happy to introduce my best friend, Dr. Edward Ramsay, a very humble, zestful, enthusiastic, passionate, and dedicated wildlife veterinarian, professor from U.S.A. Dr. Ramsay is a native of California and received his D.V.M degree from University of California, Davis in 1980. After a year in practice, he became the first resident in zoological medicine at University of Tennessee, Knoxville, U.S.A. After leaving Tennessee, he was the staff veterinarian at Oklahoma City Zoo for 5 years. Dr. Ramsay also worked in the pathology department of National Zoo, Washington, D.C. and as assistant director of Sumatran Rhinoceros Trust, a capture project in Indonesia, before returning to academia. From 1988 to 1991, he taught clinical exotic animal medicine at University of California, Davis. In 1991, he became board certified in zoological medicine and returned to the University of Tennessee College of Veterinary Medicine, where his focus was on captive and free living wildlife and large cat medicine. He was the president of American Association of Zoo Veterinarians for many years. He authored books and published many research papers. His area of clinical interest is captive and free living wildlife medicine. Dr. Ramsay is a multi-talented researcher and academician and worked in the facet of wildlife right from birds to big cat. As per our Indian tradition, we wholeheartedly welcome Dr. Edward Ramsay. It is our immense pleasure to have you here, dear sir. Today, Dr. Ramsay will deliver a webinar on therapeutic management of tigers and lions, and I am sure that this will be a great intellectual engagement. It will be my humble request to all participants to enjoy the presentation. You may put your questions through the chat window. I also request all the participants not to write anything during the webinar, including the screenshot or recording, since we are providing a detailed study material on your mail. So enjoy the webinar. All the best. Now I hand over the screen to Dr. Ramsay for his deliberation. Dr. Ramsay, sir, please.
Well, I'll start out by saying thank you very much for that introduction, and thank you very much for the invitation to come here. It's an honor to be able to present to you folks and to join you again. I had hoped to visit India and to interact with people, but that's not with our current virus situation, not the way it's worked. So with this, I'll start my presentation. All right, Dr. Harvin, can you see that?
1 minute, sir. I'm putting it live.
Okay.
Give me 5 seconds to confirm the same on the mobile, sir.
No problem.
It's good to go, sir.
Say again?
It's good to go, sir.
Okay. So you can see my PowerPoint.
Everyone can, sir.
Okay. Well, as was said, this is going to be a talk about treatment of lions and tigers. As I go through, I tend to use the word cat to mean lions and tigers, so please bear with me on that. I thought I would go ahead and, let's see. I will, this is an overview of my talk. I'm going to start out giving you a little bit of background about myself, my experience, and where some of the information that I'm going to talk about comes from. And then we're going to talk about antimicrobial drugs, antiparasite treatments, analgesics, and then some treatment of specific disease conditions that I see that don't fall easily into any of those categories. I'll start out by saying that I'm joining you from my home in Knoxville, Tennessee, and I have a small farm. And so if you hear geese and a donkey in the background, please forgive it. But that's we're all veterinarians here, so that's the way it works, I guess. So when I visited India before, I noticed that when people say, "Where are you from?" I would say Tennessee, and very few people knew where Tennessee was. So I'll start out by saying that this is the U.S. Knoxville, the state of Tennessee is here in the middle of the South, and Knoxville is in the eastern part of the state. We are in a valley that is surrounded by mountains. In fact, we have a national park just 40 miles from us that is an international biodiversity park called the Great Smoky Mountain National Park. So it's a beautiful area of the country. We're probably best known, however, as the home to Dolly Parton, the country singer who's probably the best known native of East Tennessee. So I started out by saying the University of Tennessee's College of Veterinary Medicine is in our Institute of Agriculture. The school began in 1978, and the Knoxville Zoo, which is about 10 kilometers from the university, has been a client of the school since that time. The zoo had historically one of the largest collections of large felids in North America, and so we had a tremendous amount of experience with big cats prior to embarking with our group in Tiger Haven. Interestingly, we were actually the area that had the largest collection of Asiatic lions for many years in North America, and we had the last Asiatic lion, true Asiatic lion, in North America here at Knoxville Zoo. So it's a species that is a species I'm quite interested in, and hope someday to see in the wild. Importantly, I think all the specimens which have died at the Knoxville Zoo, cats, reptiles, birds, are necropsied by our UT pathology department. And as a result, we have over 40 years of necropsy material and data from that collection, which has been invaluable. Probably the place that I have that has really cemented my interest in big cats and given us the quantity of experience that we have is a place called Tiger Haven. Tiger Haven is a large cat sanctuary founded about 30 years ago, located about 50 kilometers west of the university, so commuting distance. Tiger Haven has right now about 260 exotic felids. The majority of those are tigers. Over the years, we've actually had up to over 300 cats. So my collection, my practice has been has 140 to about 180 tigers at any time. We have about a quarter of the collection are lions, all African lions, and then the remainder includes leopards jaguar and mountain lions. So this is really kind of where I've gotten most of our experience. Tiger Haven is what we consider in North America a no-kill sanctuary. So the animals come in, they live there forever. We have a lot, unfortunately, we have a lot of large cats in private hands in North America, so there's no need to breed these animals. So we don't have reproduction, and it's not open to the public. So it is slightly different than a zoo. We have been working with them for almost 20 years now, and since 2005, all the animals that have died at Tiger Haven have been necropsied again with our pathology department. And again, this has given us a tremendous amount of information and feedback on our clinical practice. Right now, I think we have over 300 animals that have been necropsied from Tiger Haven over the last several years. And much of this is going to be has provided me a basis for what we're going to talk about, what I'm going to talk about now. So with that as the background, we'll launch into talking about antimicrobials and start out with talking about antibiotics. So antibiotics were historically, I'd say 20 or 30 years ago, the basis of the most used drugs in our practice. As everybody is aware from school, whenever you're using an antibiotic, whenever possible, you should base that on culture and potential antibiotic susceptibility or sensitivities. But in reality, we just can't get samples most of the time. And many times we have to initiate treatment before we can get any samples. And so really what I'm going to be talking about today is what we think of as empirical treatment, that is, a treatment based upon experience. And that experience really is a couple of different, based on a couple of things: suspicion of the source of infection, where you think the issue with the animal lies, and a history of what infections and what bacteria have been isolated in the collection. So when it comes to antibiotics, one thing I did want to say, I'm going to supply the host of the meeting with a copy of the formulary, and I think they will post that. I'm not sure exactly how it will be handled, but I have intentionally not put dosages or frequency into this PowerPoint presentation so that people don't have to constantly be scribbling, making notes. So bear with me on that. The formulary will include dosages, routes of administration, and frequencies for all the drugs that I have listed here in bold. So starting out with antibiotics for gram-positive organisms, penicillins are really the workhorses here. If it is an animal that can be treated orally, amoxicillin is my go-to drug as a first round. It's safe in North America. It is inexpensive. I've never seen any problems with it associated with it, and it is a reasonably broad spectrum, certainly for gram-positive organisms or anaerobes. If I'm going to go with an injectable form, if I have a cat that is down, maybe with a IV catheter in it, then I'll use ampicillin. Ampicillin can also be given intramuscularly, but typically we'll give it intravenously through catheters. And if we think I need a little bit broader spectrum, we'll use the amoxicillin clavulinate product. In North America, it's called Clavamox, but amoxicillin clavulanic acid, it can be given orally or intravenously and has a enhanced spectrum over amoxicillin alone. In animals that are, so those are ampicillin and amoxicillin with clavulanic acid are things that I would give IV during a procedure. If I'm in the field and I'm working on a cat that maybe has a laceration or some benign problem, maybe just a tooth cleaning, I will use procaine penicillin sub-Q as opposed to using one of the ampicillin or amoxicillin products. The other one that I'd like to mention as far as gram-positive organisms is Covinio or cefalexin. This is a long-acting cephalosporin drug that is on the market in the United States. I don't know if it is available in India. In domestic animals, this product has a duration of activity that will go from 6 to possibly 10 days. we've done pharmacokinetic studies. The references at the bottom are studies that we've done here at the university and at Tiger Haven. So my colleague, Dr. Andrew Cushing, did a study, and he found that Covinia has therapeutic levels out to 45 days in tigers. So actually an enormous length of coverage. There are two problems that I have with Covinia. One is it's quite expensive. So a single injection in our clinic is maybe $200 US. So that's certainly prohibitive for many animals. The other one is that it really is useful for animals that are not going to eat. And one of the things that I'll touch on now and again is that most of our cats are good eaters. So getting oral drugs into them is not a problem. Frequently, I will be trying to acquire a sample if I'm going to, and then if I find later on that it is not susceptible to Covinia, I hate to have spent that money. So Covinia is one that is in our holster, but really is kind of reserved for those cats that are so sick that they're not going to be taking oral medications. Gram-positive and anaerobic infections, for me, the hallmark ones are going to be oral infections or peridental procedures. I do all the dentistry here. I do the dentistry for the big cats, I should say, and the zoo animals at the university. This is a picture of removing the pulp material from a broken canine tooth in a lion. So endodontic procedures such as root canals and vital phlebotomies, this would be what would be a root canal procedure. These are procedures that I think are going to be heavily influenced by anaerobic bacteria. And again, I'll use penicillins as my first line choice for treating these. The other things that I will use gram-positive anaerobic spectrum would be abscesses, simple urinary tract infections. And then this is also amoxicillin and ampicillin are drugs that I'll use if I have an infection of unknown origin. If the animal is febrile, maybe has a leukocytosis, but I can't identify where the exact location of the infection is. This is a safe, inexpensive, and available therapeutic to go to. When it comes to gram-negative organisms, gram-negative infections, probably the one that comes immediately to mind for us are pyometras. So pyometras are uterine infections. This is a picture of the uterus, infected uterus removed from a tiger. On your right, on the left part of the screen, to your left are the ovaries with clamps on them. You can see the two distended uterine horns. And then up at the top of the screen, you can see some white material that's pus that's leaked out of an area where the uterus has been ruptured. And then in the center is the distended uterine body. We've seen about 50 pyometras in our collection, and that's in our practice, and that's quite a few. It's not something you see in domestic cats because domestic cats are typically spayed and or bred. Why I think it happens in our animals is that our animals are intact largely. They're not being bred or having babies. As a result, they're being exposed to repeated bombardment with progesterone. We've identified that they are spontaneous ovulating, ovulating spontaneously in our collection. And as a result, we have these ascending enteric infections in the uterus. In dogs, the dogma, in no pun intended, in the United States is that you should never sleep on a pyometra. They're a crisis that needs to be addressed. Actually, in our large cats, that's not been the case. The cervix is typically open. The animals are not sick. The animals don't exhibit PUPD, polydipsia, polyuria. And so we can begin treatment with antibiotics and then schedule them for surgery at a more elective and non-emergency time. We treat pyometras by spaying these animals. It's a taxing procedure. It takes 2 to 3 hours, and it is one that has some morbidity associated with it. That said, if an animal needs to be salvaged for reproductive purposes, if it's a reproductively important cat, they can be managed with prostaglandins and antibiotics. It just doesn't happen to be what we want to do in our practice because we're not anticipating breeding these down the road. But if you're going to try to, if you want to salvage a cat after you clear the pyometer, you should try to breed it as soon as possible. The other gram-negative, we do have fevers of unknown origin caused by enteric organisms or gram-negative organisms. And really our workhorse here is enrofloxacin. Enrofloxacin is a fluoroquinolone. It was quite expensive. It's gone generic and seems to be quite reasonably priced now. We used to use it as a last resort. I'll be honest, we use it quite honestly as a first resort now. Many of my interns and residents, this is their go-to drug. Many of you may be aware that enrofloxacin has been associated with retinal lesions in cats and domestic cats. And in fact, my ophthalmology colleagues at school do not like to use enrofloxacin in domestic cats. We actually did a retrospective study to see if we were inadvertently causing retinal damage, and we saw no evidence of retinal damage in our practice. So we continued to use it somewhat freely and feel that it's quite a good drug in our hands. I also am a fan of trimethoprim sulfa, which can be given orally. Many of my small animal colleagues are a little concerned about TMS for side effects that are seen in domestic dogs. That's not been a problem in my hands in large cats. So I see trimethoprim sulfa as a perfectly legitimate antibiotic for susceptible organisms. Fungal diseases are actually a fairly common problem in our practice. The radiograph on your right is that of a dog with blastomycosis.
Sorry.
So to finish off on antibiotics, the antibiotics that I've listed here in the presentation are the ones that we keep in our box and carry with us at all times. That is to say, the injectable ones. There are a host. The formulary has a host of other antibiotics, chloramphenicol, clindamycin, doxycycline, that we've also used. The ones that I'm emphasizing today are the ones that we use most commonly. So, and I'm not to say that these should be used exclusively. And as I said earlier, this is something that, this is our practice. This is the way we handle things in our practice. Other people will choose to handle things differently. Moving on to fungal drugs. And fungal infections, systemic fungal infections are actually quite common in our practice. We have two, blastomycosis and histoplasmosis, that are the ones that we've seen. The radiograph that you hopefully can see on the right side of your screen is actually a dog with blastomycosis, a thoracic radiograph. And this is a fairly characteristic extensive lesion, similar to what we've seen in our cats. Occasionally, certainly with histo and early blasto cases, they won't be this extensive. We'll see just individual granulomas and masses. Blastomycosis, I believe, is limited to the Western Hemisphere, North and South America. Histoplasmosis, I believe, is worldwide and something that you may see or have already seen in your practice. The trouble with our fungal infections is that they have fairly non-specific clinical signs. The animals just are down. We have a phrase here in the United States, certainly in East Tennessee, we say, what's wrong with this animal? It just ain't doing right. So ADR stands for ain't doing right. And so an animal that is ADR is just an animal that has vague clinical signs without pointing us in any direction. All of these cases, all of our fungal cases initially, or at some point in time, have had pulmonary lesions, but pulmonary signs are not necessarily evident. So in other words, they're not showing sturdor, they're not showing any evidence of pneumonia, even though they have it. Diagnosing these guys is difficult. A large part of it is based on suspicion of infection, history in the collection. Before we would diagnose blastomycosis based on radiology and cytology of tracheal washes or bronchoalveolar lavages. In animals, we might see biopsies if we had skin lesions. That's more common in exotic canids and in dogs than in cats, in my experience. And more recently, we have a urinary enzyme immunoassay that looks for antigens, and that's actually been our workhorse. I'm not sure that that's available worldwide, but it's been a great boon to our practice because it allows us to basically diagnose this without having to bring an animal in for radiology. I want to mention that really very seldom do we actually culture either any of our fungal infections or systemic fungal infections. Diagnosis by culture is actually quite rare. The workhorse for treating our systemic fungal infections is itraconazole. Itraconazole in the United States is available as an intravenous drug, but it is very dilute, and an animal would have to be essentially hospitalized, which really isn't an option for our cats. So itraconazole in my hands is only an oral drug. It's expensive. We figured that for our average tiger, it is about $2,000 to $2,500 US per month to treat a cat. So that's expensive to the point of prohibitively expensive. There is a generic formulations out now, which are good. In the United States, because the tablets are quite large, many people have looked to compounding pharmacies to provide them with formulations. And those need to be avoided because actually the compounded formulations do not have blood levels that are in the ones that we have looked at the University of Tennessee have not produced blood levels that were sufficient to treat these infections. So we tend to tell people in the US to avoid compounded formulations of itraconazole. Generic formulations are fine. The other antifungal drug that we use quite a bit in our practice is fluconazole. It's another azole similar to itraconazole. It is much less expensive than itraconazole, so that is a plus. It is gets better penetration into the central nervous system, and certainly in at least 2 cats, tigers, that I've had with blastomycosis, we've been able to clear the thoracic lesions using itraconazole, but the animals have developed granulomas in the brain and succumbed to CNS blastomycosis. So we have gone to a system where if we think the animal has blastomycosis or histoplasmosis, we'll start it on itraconazole for 2 to 3 weeks, depending on how well the animal does. And then we'll switch it to fluconazole to give us a better price, to save us some money, and also to hopefully protect the central nervous system. One of the important things to remember about this is that these fungal therapies need to be continued for quite a long time. And we've had some cats on these for months, certainly at least 6 weeks, and frequently much longer. So, and to date, they have been safe. So many people are concerned about liver toxicity, liver permutations. We've actually done some monitoring and seen some mild elevations of enzyme activities that would suggest liver damage, but those have been reversible when the drugs have been either reduced or removed. So itraconazole kind of first and fluconazole second has been our formulation for our systemic fungal infection. We have had one really remarkable ringworm outbreak in our practice at Tiger Haven. In our situation, it was Microsporum canis. This is a picture of a lion with a bald spot on the back of its neck. I try to tell my students and residents that baldness is not a disease. It's actually something that I think improves somebody's appearance. They're not always that willing to believe that, but that said, ringworm, when it has shown up, it was amazing. We cultured microsporum out of the animals. We cultured it out of the office desk on the office. We cultured it out of bird nests. It really was ubiquitous. We actually did a science project, Dr. John Sykes, it's listed down there, did a science project on this where he attempted treatment of individual cats, treatment of exhibits, and cats and exhibits. And the result was that the control animals got better before any of the treated animals. So ringworm is not something that I necessarily treat. If I have an animal down and I think it is going to, it might have a ringworm infection, the way that I'll treat it is to clip it up, I'll wash it with betadine soap, and then apply a topical antifungal such as miconazole. I will say that in rare cases, and I'm thinking immune suppressed animals, also red pandas, another animal from that's native to the Himalaya in India. Systemic ringworm infections can be quite severe enough, in fact, that it requires systemic treatment. And in those situations, again, we'll use itraconazole to treat it. As this is mostly in red pandas, and we've done that with young pandas for weeks at a time without any problem. I'll mention also that ringworm can occur in veterinarians. This is actually a picture of my forearm from when we were treating the animals at Tiger Haven. This picture was taken by one of our dermatologists, and I think it's every student at the University of Tennessee has seen this picture, and probably it's been in several book chapters. It resolved without treatment. It was remarkably pruritic. I was quite surprised how itchy it was. But I'm amused because this is probably the best distributed picture of me possibly in the world. Something that I think should be mentioned because it's a problem that individuals will suspect ringworm, but is something that we've seen in both Tiger Haven and the Knoxville Zoo, and that's what I call lymphocytic dermatitis. So these are a picture of a couple of tigers that have a lesion. You can see the alopecia on the neck here on the right, and you're looking at the neck on the left as well. There's some lichenification, some thickening of the skin. When we biopsied these, the other presentation, this is not as good a picture, but I think you get the impression of this kind of punctate alopecia on the trunk. There's a large patch of alopecia on the back leg here. This is when you look at this, this would be almost a classic ringworm presentation, but biopsy this, we come up with something quite remarkable. The biopsies show a tremendous number of lymphocytes. And in fact, when we first turned in a biopsy on one of these cats, the pathologists were absolutely convinced that it was a neoplastic disease. It was cutaneous lymphoma. The good news is it doesn't behave like cutaneous lymphoma. It is not. We've had these animals, some are seasonal. So we've had some cats that are our summer cats that have this condition and they resolve in the winter. We've had other cats that have it in the winter and resolve in the summer. We've had cats live with it the rest of their life. And we've had others that have resolved spontaneously. So it's the exact etiology is unknown, and as such, we've thrown a variety of therapeutics at it. And unfortunately, we're still at a loss to come up with a good treatment for this. That's the bad news. The good news is, other than being unsightly, it seems to be benign and doesn't affect the animal's welfare. So moving out of antimicrobials, let's talk about antiparasitic drugs for a few minutes. In our practice, the major parasitic disease is ascarids, Toxascaris or Toxocara. Well, cats have both. It seems like all our cats are infected. None of them seem to have clinical disease, or rarely is there clinical disease. In my opinion, if you have these guys on turf or on a dirt substrate, it's probably impossible to eradicate ascarids from these animals. And so This is a problem or a parasite that our animals live with. We routinely, as a result, we don't do a lot of fecal exams on these guys because they all show up as positive. So we just go ahead and routinely deworm them, typically 3 times a year. The workhorse for us here is pyrantyl pamoate. In North America, it's called Strongyne. It's a non-toxic drug. It's inexpensive. It's used. It can be administered once and is effective. We've also used fenbendazole for both ascarids and other parasites. Fenbendazole needs to be given at least 3 days in a row. Some of the parasitologists feel that it needs to be given 5 days in a row. As such, it becomes a little more expensive and a little more difficult from a manpower standpoint to administer, and that's why we've pyrantyl pamoate is the drug that is kind of our major anti-parasite treatment. And the other parasites that we look at, canine heartworm is something that occurs sporadically through the United States, predominantly in the South, although it seems to be extending its range into northern U.S. as well. It's something that, as you all know, probably affects, is primarily a pathogen of dogs. It can affect domestic cats, and domestic cats can show clinical signs with relatively light infections. In the exotic cat world or the non-domestic cat world, the only cases that I've seen have been snow leopards, and that's 2. One is actually a clinical case that died. The other was an animal that was a occult heartworm positive. We have done some surveys in our collection. We historically would look for antigen, look for heartworms and look for antibodies, and we would not see heartworms themselves on a cult test, but we would see a number of cats have antibodies suggesting lions, tigers, leopards are infected, but only snow leopards are the ones that I routinely treat. We treat them with monthly ivermectin. In this situation, I use the bovine injectable ivermectin, and the dose for bovine injectable ivermectin on the bottle is 0.2 milligrams per kilo. When I've given that to orally to big cats, a couple of animals have shown, tigers have shown some what I'd call adverse effects. They've gone off food, just looked kind of like they didn't feel well. So we use the what I consider in our practice the canine preventive dose, which is 0.05 milligrams per kilo. That's in the formulary. We use that monthly, and we use that year round. And actually, that's been quite successful. In Knoxville Zoo, where we have relatively few cats, all our cats have been on it. And I think that since they've been on monthly ivermectin, the helminth infections have been, we don't see that much, many worms passing these guys either. I think that's also been effective. On the one snow leopard that was a cult positive, we just went ahead and started it on monthly ivermectin at that lower dose, that 0.05 dose. And that animal cleared up and was fine when it succumbed many years later. It was negative for heartworm. Other ectoparasites are a problem, and in our practice, these are very seasonal. So fleas and ticks will go 2 or 3 years without any problems, and then all of a sudden we'll have a year where there's just a tremendous amount of fleas and ticks. And with respect to fleas, snow leopards again seem to be particularly susceptible, and those are the ones that we probably treat as soon as the summer season starts. We treat in anticipation. Other cats we don't, unless we start to see from the outside that we can see that they are starting to carry heavy tick burdens. In that case, we may go ahead, and that will vary with where they are on the property. We've used just about any product that can be used in a domestic cat on a same milligram per kilo basis, and those have been fine. Right now, we are using Bravecto. This is a new drug for a lander. It's unfortunately expensive again, but it seems to be some of the other flea products don't seem to be that working that well for ticks. And Bravecto has been one that we've just turned to this year. This has been a particularly bad year for ticks. The other one that we use on these guys and can be used as a Bravecto is given. It's actually good for 3 to 6 months, depending on dosage and really we don't have enough experience. I don't have enough experience yet to really say which of those is going to be correct. If we see that we have a heavy tick burden or even a heavy flea burden, and we just want to get rid of that very quickly, we'll use Capstar or Nitropyram. This drug is extremely safe. We use it as 2 to 3 times the large animal, large dog dose, and it's worked well for us for eliminating ticks. We also use it for maggots. If we have, it's rare that we have something that is struck with maggots. We see that more commonly in bears than in cats. We'll use that, and then, but it is only good for the day that it is given, and so we will follow that up with Bravecto or another product for long-term prevention. Other anti-parasite, the other one that I would mention is when it comes to blood parasites, most of you probably have much more experience with this than I. Just in the last year and a half, we've seen cytoxoin come into our collection. Clinical signs are vague. Again, these animals just aren't doing right. They seem funky. When we get a hold of them, they look at their blood. They're actually very seldom are they parasitemic. Parasitemia is pretty rare, and unless the animal is quite sick. As a result, we've been using PCR for some of these animals. When we do that, we've seen a number of animals. When we've gone back and done a retrospective serosurvey, we have a number of cats that are serologically positive for cytoxoin, but show no clinical signs at all. So it's really a bit of a dilemma for us. This is going to be one that we're going to be examining more in the future. Right now, we're using atoquazone and azithromycin to knock these infections back. But I have to be honest, we only have a few animals that we've tried this on, and most of those animals had a high index of suspicion, but not a definitive diagnosis for cytoxoin. So we haven't been able to really nail this one down yet. It has been seen at a sanctuary in Arkansas, and colleagues at Missouri feel very good about this drug combination for knocking down cytoxoin infections. So moving on to analgesics, I think probably the thing that I find most interesting is that as I look at our pharmacy, the shelf that includes analgesics has grown almost exponentially, and the drugs that were formerly widely used, antibiotics and antifungals and antiparasites, occupy a smaller and smaller area in our practice. When I think of analgesics, I really think of in two different scenarios. So one scenario would be acute pain, and I'll use as a model for acute pain, peri-operative pain. This is a lion about to undergo a pyometra surgery, and I don't know how many of you work in academic practices, but one of the things that you have to get used to is the number of people that are involved in any of these procedures. So this is a lion in a prep room that's made for dogs and barely fits, and with all the people in there, it doesn't make it any easier. So to walk you through what we do, let's say if we anticipate a pyometra surgery, before the surgery, earlier in the day, we don't feed the animals, we fast them and thirst them, but we do give them just a small treat with some tramadol in it. Tramadol is an opioid pain medication. My colleagues in rehabilitation are not that fond of it, but canine practitioners, we found it to be very effective in our practice, and keepers really can tell when the animal doesn't get enough tramadol or has missed the dose. So tramadol is given orally the morning of surgery. Inter-op, we would use meloxicam. Meloxicam is an NSAID that I'm sure many of you are familiar with, that has been widely used in our practice. So we will give meloxicam subcutaneously during surgery. If it is a painful surgery, an abdominal surgery, we'll use buprenorphine. Buprenorphine is a mixed partial mu agonist and a kappa antagonist, and we found this to be very effective in our practice. And then we will also use lidocaine as a local block for incisions. And then post-surgery, we will use meloxicam and tramadol for our post-op care. One of the things that I think has always impressed me about our cats is that even after we've had many of these guys, we've done many pyometra surgeries, most of them will eat the night of surgery. They'll wake up, they'll go home, and they'll still take oral medication, which is remarkable. And so while we have used sustained release buprenorphine products, it really isn't required, or it hasn't been required in my hands. Early on, when we started working with Tiger Haven, we had some of our anesthesiologists were very oriented to alleviating pain, and we were doing morphine epidurals. We were using buprenorphine intraoperatively, and then some fentanyl compounds post-op. And when we had those situations, I actually had 2 to 3 cats show opioid dysphorias. So they would start when they finally were starting to wake up, they would start not being able to orient, almost manic, turning and flipping over in the cage. Those animals, we treated them with naltrexone, and they immediately resolved. So that's how we diagnosed it. But since that time, I've been pretty cautious about using injectable opioids. I've never had any trouble with tramadol, but usually I'll use buprenorphine once, maybe twice. The dosages are in the formulary, but it's not. But I actually am probably much more cautious about using opioids in large cats than maybe some others might consider. The alternate is chronic pain, and for chronic pain, we're really looking at probably two of our most common presentations are osteoarthritis and neoplasia. So our go-to drug again is meloxicam, the NSAID. It's approved for use in the United States. The approval for use is once, 1 injection or 1 dose the day of surgery for cats. And as a result, a lot of my colleagues are concerned about using meloxicam repeatedly. I can tell you that we've used it in maybe 100 cats. We've given it to many lions and tigers, and we routinely give it multiple doses. So typically what we'll do is we'll start out with a loading dose of 0.2 milligrams per kilo, then we'll drop down to a 0.1 milligram per kilo dosage for a number of days, maybe up to 2 weeks. And if we're going to leave an animal on it long term, we drop that down to 2 or 3 times a week. And then that 2 or 3 times a week dose at 0.1, we've had animals on it for years without adverse clinical signs. We did a retrospective of renal lesions in our cats, and we found that a number of them had renal papillary necrosis. Interestingly, out of 100 cats, 10 had renal papillary necrosis, 5 had received meloxicam, 5 had not. But when you looked at the numbers of those that were treated versus those that weren't, the numbers that received meloxicam, the animals that received meloxicam did have a significant difference. They were more likely to have renal papillary. almost no hesitation about leaving that on for years. Not sure what happened there. All right. I may have done that inadvertently. My apologies. Can you still hear me, Dr. Arvin?
Yes.
Yes, sir.
Okay. Then I'll continue.
Yes, sir.
So another NSAID that is used occasionally in our practice is piroxicam. Piroxicam is probably considered not to be as well tolerated as meloxicam. We've used it mostly as an anti-cancer drug, but when we've given cats that have tumors piroxicam, taken them off meloxicam, given them piroxicam, some of them have had improvement of their lamenesses. So piroxicam is something to consider in our practice as an alternative to meloxicam. Tramadol is the other one of the other drugs that we use for chronic pain. So tramadol twice a day. We use that at a pretty low dose, 100 to 200 milligrams per adult animal. Seems to be quite effective. And gabapentin, a neurotransmitter, is also that is used in people for phantom limb pain, is also something we use in our practice. And I would say on our older, very painful osteoarthritis cats, it's common for them to be on meloxicam twice a week, tramadol and gabapentin daily. And that seems to be a successful and non-toxic way to approach these guys. We have tried other drugs, amantadine and adequine. I've not been satisfied that we really gotten much response out of these. And so these, I've listed them as some of the other things we've tried, but meloxicam, tramadol, and gabapentin are really our drugs of choice for chronic pain. All right, I'd like to talk just a little bit about some specific disease conditions that we see in our practice. Tiger Haven, because animals are allowed to live, we have a lot of cats that are greater than 15 years old. In leopards, so we have a number of leopards that are greater than 20 years old. And so I have a lot of geriatric conditions. And so I thought I would take just a few minutes to talk about some of the issues that we see that don't fall neatly into some of those previous categories. Spinal osteoarthritis is one of the things that is very common in our practice. We see it in animals that are older than 15 years old, lions, tigers, not so much leopards, mostly our bigger cats, lions and tigers. It seems to occur in the thoracolumbar region, the caudal thorax spine, the thoracolumbar junction and the lumbar spine. This is a picture of a tiger with a collapsed disc where the disc is impinging upon the cord. We see these clinical signs. The animals start to have rear limb ataxia. They start to wobble on the back end. They start to have hind quarter muscle wasting, so the wasting of muscles over the rear legs. We don't see incontinence that often unless it's terminal. So mostly rear limb ataxia and muscle wasting. The drugs that we use on this are prednisolone and tramadol and gabapentin. So prednisolone seems to be much better than meloxicam at alleviating these clinical signs. If we think we have a spine cat, as you probably know, prednisone needs to be metabolized to prednisolone, and cats cannot do that. So we use prednisolone and not prednisone in this. I'm fairly conservative, so my doses are 0.5 milligram per kilo per day, either well, once or twice a day. And then I try to taper the dose as soon as I can, mostly because I'm concerned about if I immune suppress these guys severely, I'm concerned about secondary bacterial infections. And we've had a couple of cats that have got secondary fungal infections after being on heavy doses of steroids for long periods of time. As you probably know, you should avoid using NSAIDs with a steroid. And so we use when we have an animal on prednisone, we avoid meloxicam. Tramadol and gabapentin, however, are safe to use, and they've been effective in our hands. Some of these guys actually do quite well for a long time. There is something that we've observed in our practice, and you may observe in yours. I'm not sure if it's an Asiatic lion problem, but certainly an African lion problem, and that is spinal arthritis of the neck. So what we realized when we did some retrospective work on let's say morbidity, looking at who's getting sick and when, we noticed that our middle-aged lions, and male African lions, animals that are 9 to 12 years old, were starting to show clinical signs that initially we thought were brain lesions. So the animals would show ataxia on all 4 limbs, and sometimes some disorientation, which in retrospect I think was probably pain. Many of these animals we tried to work up for brain lesions, doing MRIs and CTs, and we didn't find anything. What I think was a problem is these are these big male lions are large cats. They barely fit into the MRI or CT machine. But certainly by the time you get back to the caudal cervical vertebra and their shoulders, they don't fit in. And so we weren't going back far enough in our imaging. It's a disturbing disease because once it starts to occur, you can see this disc kind of actually an osteophyte kind of protruding in and really truncating the canal there. The signs are pretty rapidly progressive. So these guys will start to get wobbly, start to seem disoriented, and fairly frequently will go rapidly to lateral recumbency. And then they're pretty frustrating. So if we see this and we suspect it, we'll start them on prednisolone and gabapentin and tramadol as needed. But this is really only palliative care and not something that's going to be curative. I need to probably make a comment on this, because when we brought these animals in, and whether they're in the thoracolumbar area or in the male lions in the neck, we've had our neurologists and our surgeons say, gee whiz, we should be able to help these guys. We can go in and potentially free up some space so that the cord isn't so impinged. And the trouble with that is not the surgery. The surgeries can be done, and most of our surgeons are very skilled. The problem that we have with those is the post-op care. We have done a couple of spinal surgeries, and on very good cats, you just cannot provide them with the appropriate post-operative care. Expressing the bladder, turning routinely. So surgery has not been something that we've looked at for these spinal problems. It really is something that we treat medically and palliatively. The other common disease, I would say almost 100% of our geriatric cats have some quantity of renal disease. The problem, this is actually a domestic cat image, but it's very typical of what we see in our big cats. It's almost invariably an interstitial nephritis. We've seen a few pyelonephritises. It seems to be that's been more common lately. Almost no glomerular disease. Very interesting in our lions and tigers. So it's an interstitial nephritis similar to what's seen in domestic cats in old age. The animals present with polydipsia, polyuria, hind limb wasting. That comes up on a couple of these. So parsing out which one of these are renal and which are spine can be difficult. We do when we see these guys, in my animals that are eating all meat diets, increased BUN and creatinine concentrations is fairly common. Using the U.S. Units, a BUN of 30 or 40 is fairly common in a normal cat. We will see these guys get up into the 60s and 80s for BUN. Creatinine will be, and those will be compensated cats, and they can live quite a while with that. Creatinine in the normal cat will be 2 to 3, and we'll see them get into the 3, 4, and 5 category, and compensated cats, and they seem to do quite well for a long time. Where you start to see the pack cell volume decreasing, where you start to see anemia, if they become isosmonouric. And the one that I look at more closely now than I did previously are serum phosphorus levels. You start to see serum phosphorus rise, you're probably in trouble. You're probably in a terminal situation. The trouble on renal diseases is very difficult. There's really no treatment. Most in domestic cats, we will treat them over to a KD diet or a kidney diet. We can support them with parenteral or sub-Q or even IV fluids. Neither of those are really available to us in our big cats. There is a drug in North America called Azadil. It's a probiotic intended to decrease the amount of blood urea nitrogen in the gut before it gets reabsorbed. That's not been very effective in our hands. And in domestic cats, I would say the one area that we haven't explored as well as we might is hypertension is very common in chronic renal disease, terminal renal disease in domestic cats. We only really monitor blood pressures when we have animals in for surgery. And let's face it, those guys are anesthetized with a host of drugs on board. So our ability to monitor for hypertension is relatively poor. I will say that we've looked at ocular at the back of the eyes and at necropsy for other tissues, and we haven't seen issues of lesions that would suggest hypertension. So for right now, we don't treat chronic renal problems for hypertension. All right, we'll finish up a little bit with a couple of comments on neoplasia. Neoplasia is, again, very common in our practice. We went back and did a retrospective a couple of years ago, Heather Clough, a student, and over 50% of our geriatric animals will have a neoplasm, much more so tigers and lions than necessarily leopards, interestingly. And about a third of those animals will have multiple neoplasms in their lifetime, not all malignant. The picture that you see on your right is a 22-kilo uterine leiomyoma that we removed from a liger, a geriatric liger. I'm not sure that we would have done that surgery. This is something we did years ago. I'm not sure we would have done it today. We have a host of tumors that are seen in domestic cats, a couple that merit some mention, and I've got 2 specifics I'd like to talk about. Sarcomas we treat typically with surgery. Multiple myelomas we find when an animal's hypergammaglobulonemic. We've tried steroids with these guys, but most of them, by the time we diagnose them, are rapidly progressive. Lymphoma is one that has been a real frustration. The clinical signs are really non-specific. And once we have a diagnosis, every cat that we've had a diagnosis of lymphoma on has died of lymphoma. So those have been frustrating cases. They aren't associated with FELV. And then meningioma is something seen in domestic cats and actually in our big cats as well, mostly in incidental findings at necropsy. The 2 tumors I'd like to mention though, and have some discussion on. One is mammary tumors. About 50% of our female tigers will develop a mammary neoplasia. The lesion that you're seeing here on the right is actually metastases to the lungs. This is something that happens late in the disease. They more frequently metastasize to regional lymph nodes and then abdominal lymph nodes first. Almost all of these have happened in intact females or females that have been intact for years. They are uniformly malignant, similar to the tumors, the carcinomas that are seen in domestic cats. If we have early detection, that is to say we find a lump mass, we've actually been successful with this, removing that single mass. Most commonly, this would be an animal that came in, let's say for a pyometra surgery, and as we're clipping it up for prepping it for surgery, we find that a single mammary teat is associated with a lump. So when we go in for the surgery, we'll go ahead and take that teat out, that mammary unit. And in that situation, we've been quite successful. But again, those have been, I would say, serendipitous findings Those weren't things that were clinically apparent and were available because we had the animal down and literally had the animal clipped on the table before we identified them. More often, we don't find this disease until it's extensive. Sometimes even the tumors will rupture. And at that point in time, in our hands, extensive surgery, such as radical mastectomies, is really not indicated. Those tumors have almost invariably metastasized. And so putting an animal through an extensive surgery like that, I think actually sets it back. I have been amazed. We've had several cats that have survived for years with identified large mammary tumors, and even some that have ruptured. So I think going with a conservative approach, treating it with either NSAIDs or possibly steroids, certainly pain, and if there is an infection, secondary antibiotics, I think is the way to go on this for animals that have extensive disease. Then lastly, I'd like to talk just about something that we've seen in our practice now 4 times, and that is melanomas. This is the muzzle of a lion. He's laying on his right side down. You can see tongue, endotracheal tube, nose is to your left. That's a large melanoma. All the melanomas that we've seen in our big cats have been on the face, or at least primarily on the face. They do metastasize and throughout the body late in the course of the disease. But initially, the ones we found have been on the face. We find that surgical debulking has been the way that we like to proceed with this. We follow with radiation. And then interestingly, there's a vaccine for melanomas. It's given intradermally. It's unfortunately quite expensive, but it's allowed us to extend the lifespan on these guys from what should be about a 6-month survival time to survival time in the years. So something that is worth investigating if you find melanoma in your situation, in your collection, or on one of your cats. With that, I'd like to thank just a whole bunch of people. First of all, I'd like to thank Dr. Arvind. He has been outstanding in providing support and in making this possible. We truly could not have been here without him. This is a picture of Dr. John Sykes, currently one of the head veterinarians at the Wildlife Conservation Society, when he was our resident treating our cats for ringworm. Debbie Chaffins, who you can just barely see in this picture, is a curator at Tiger Haven. It's absolutely excellent, one of the best curators I've ever worked with. Mary Lynn, the director and founder of Tiger Haven, they have been flawless clients and have really let us do a tremendous amount. And I hope I think they appreciate that it has been a mutually beneficial situation. I need to also mention my colleague, Dr. Andrew Cushing, has been an excellent colleague, and then all the residents, interns, and students who have assisted us over the years, really too numerous to mention. So with that, I would like to say thank you, and I'll be happy to try to field questions. Not sure how that is going to exactly happen or for how long, but we'll take it from there. I'm going to switch over out of my presentation mode.
Thanks a lot, Dr. Ramsay sir, for your presentation. There have been there are almost 150 questions that I see in front of me. And actually, most of them have been are about the dosage. But as you said in the beginning, that you would be sharing the PDF of the formulary and the dosage, which we will make it available on our website. I think that would be more beneficial because the users would participant would also be able to refer to it in the future. So right. I think we can skip those questions and just let me go with some of the questions which are not related to the dosage. For example, Dr. Raju Kumar Devri, he wants to ask, sir, how to diagnose pyometra and other reproductive problems in tigers?
Yes, so The pyometras, the good news with our tigers and lions, it actually occurs more frequently in lions than in tigers, but our collection is biased towards tigers. Actually, they have a vulvovaginal discharge. So there's the discharge that comes out the back. And so actually our curator identifies these animals most commonly. So she'll go out, so the cat will be actually fine. As I said, they will not be sick. They don't have PUPD. They're not febrile, but you'll see this kind of yellowish in lions bloody discharge coming out of the vulva. And now if we know that it is an animal of appropriate age with a discharge, it's almost always a pyometra. And so we bring those in. Initially, we would radiograph them and ultrasound them. Radiographs were not very useful. Blood work was not very useful. These guys typically do not have a leukocytosis. The blood work is actually remarkably normal. Ultrasonography of the reproductive tract is by far the best diagnostic tool. If you're looking for a cat that you're going to want to salvage reproductively, ultrasound would be the way to diagnose it, in addition to a vaginal exam. In our hands, we go almost straight to surgery to alleviate the cost of ultrasonography and the time that it takes. Getting those animals into ultrasound and doing a thorough ultrasound exam takes almost an hour in our practice, and that prolongs the anesthesia and prolongs the cost.
Okay, sir. Another question is, do you use any special tricks to bait the big cats for oral medication?
No, actually, again, the keepers do most of it, but most of our medication is supplied in chunk meat, what we call chunk meat. So it's we use beef, and then we carve up a small chunk of beef, put a hole in it, put the medication in it, and toss it in. Certain animals are a little more picky, and getting oral medications into some can be a challenge, but I would say chunk meat for most of our cats is the way that we go.
Dr. Vinu David, he's asking, which fungal disease is seen most commonly?
In our practice, it's blastomycosis, although it seems to be somewhat seasonal. We haven't seen a case of blastomycosis in about 5 years, and we saw 5 cases of histoplasmosis last year. So why that is changing, I'm guessing it is an environmental issue. The trouble is that it's almost, these are saprophytic soil fungi that are almost impossible to eradicate from the environment. So we haven't been able to, we've explored environmental treatments, but we haven't found one that's effective.
Dr. Rajkumar Jadhav, your experience pertaining to metabolic bone diseases and intervertebral disc disease in lions and tigers.
Yeah, so the good news is I have not seen any metabolic bone disease in an adult animal in either of our practices in Knoxville Zoo or at Tiger Haven. We have seen metabolic bone disease in young animals. Usually, it's most common in our hands in young, for some reason, mountain lions or American puma or cougar. Those animals are invariably hand-reared animals that have come in, and the animals have been removed from milk diets early and switched on to all meat diets, and the meat diets are not supplemented with calcium. And in those situations, they deteriorate very quickly. So as far as classic metabolic bone disease that's caused by low calcium, high phosphorus diet, that's not something that is a problem in the adult animals. I don't think it is a component of the spinal osteoarthritis. I think the spinal osteoarthritis is a factor of 2 things. I think one is our animals, well, maybe 3. One, our animals are much longer lived than they are in the wild. So when you look at an animal, a lion in the wild, to find a 10-year-old lion in the wild, many of the colleagues out there will know better than I, it would be very unusual. So we have animals that are maybe twice as old as they would be if they were living in the wild. Number 2, they're not getting as much exercise as they would in the wild. And number three, despite our best efforts, many of these animals are heavy. Many of these are overweight, certainly carrying much more weight than they would in the wild. And I think all three of those contribute to the spinal disease.
Another question from Dr. Rajkumar. Based on his experience, he's saying that posterior paralysis in tiger or lion is quite difficult to manage. What is your perspective over this issue?
Clostridial?
Posterior paralysis.
Yeah, I've never seen a clostridial paralysis. That may be something that is more common in India than here. I have seen clostridial enteritises, and those respond actually quite well to penicillin. So I'm not sure that I have any experience with clostridial paralysis.
Okay, sir. Which route is most effective in big cats for administration of drug?
Well, our animals, if they feel halfway decently, they do fine on oral drugs. You know, one of the things that we have a ability to bring animals into fairly tight enclosures. So we actually move animals around in something we call menagerie cages. They look like something you might see in the circus. And in those situations, we can get within 6 or 7 inches of the animal. And so we can administer hand injections with the animal just leaning up against the wall, even in untrained animals. One of the things that's amazed me is when the difference between giving an animal a hand injection and then darting it the difference in the animal's response is remarkable. Once you have to go to a dart, the animal is much more scared, much more excited. And if you're having to dart it in a large enclosure, you're up again, you get much more exciting again. So we have been very lucky that we can bring these guys into the small cages and do hand injections. In our hands, that's fine. If I had to treat them just in large enclosures, oral drugs are the way to go.
I think, sir, there are 2 questions which relate to the vaccines. One of them is very specific for the Knoxville Zoo. Against which disease do you vaccinate the tigers and lions at the Knoxville Zoo, Tiger Heaven?
Yeah, so we vaccinate, the core vaccine for domestic cats is feline panleukopenia, which is feline parvovirus, calicivirus, and herpes virus. So we vaccinate all our cats for those. We used a kill virus vaccine for that called Filovax. We also vaccinate for rabies. Rabies is not common in our area, but it is kind of a why take a chance kind of thing, and it's considered a core vaccine for any cat that's housed outside. And then we vaccinate the cats at Tiger Haven, specifically the tigers, specifically the tigers for canine distemper. And in that we use the PureVax canary pox vectored vaccine. It's a monovalent vaccine. There are 2 forms of it. One is made for ferrets called PureVax ferret distemper. The other is made for dogs. It's called Recombitech CDV. And either of those seem to be effective. The PureVax vaccine is the one that is more antigenic and the one that we use most commonly. Those are the vaccines that we routinely use in North America. FELV, feline leukemia virus vaccine, is not considered a core vaccine and is really only used, is not commonly used anymore. Chlamydia is not commonly used anymore. And feline coronavirus or FIP vaccine is not recommended except in exceptional situations.
Okay, sir. Another question from Dr. Sachin Rao. Whether spinal osteoarthritis is related with sex? I mean, for example, say, is it more in male tiger and less in tigress?
Not in our experience. It seems to be the only sexual predilection is that situation I mentioned in male lions. The male lion, when we looked at our male lions and compared it to female lions and tigers, it was actually statistically different. The male lions were much affected younger, and they were affected in the neck, where all our other cats, lions, female lions, and male and female tigers, the lesions are in the caudal spine and in animals that are much older.
We have two more questions, sir, because we're running out of time. So I'll just take two more.
Yeah.
One of them is, do you recommend oxytetracycline in tigers?
You know, it's not something that we've had to use very much. When we have used tetracyclines, it has been doxycycline, and it has been usually because we have an organism that is not responding to the other drugs, and doxycycline represents a completely different spectrum and mechanism. So I would say there are pharmacokinetics for oxytet. It's a very painful injection if you're looking at giving injection. I don't like to give oxytetracycline as an injection. The biggest issue that I have with doxycycline, and to a lesser, and my experience with oxytet is actually so old that I can't even comment anymore, is that it seems to be rough on their stomach. Animals may, you start them on it, and animals may frequently go off food or don't like to take it.
All right, sir. Last question we'll take, sir. Which type of hemoprotozoan disease you have come across in tigers and lion, and what would be the treatment?
Yeah, I mentioned that the only one that we've seen is cytoxoan so far, and we've only seen a few cases. That seems to be coming up relatively. It's a relatively recent disease for us, seriously only in the last year and a half. And we've used the atoquazone and atoquazone and azithromycin combination.
Okay, so we still have so many questions, but I think I mean this is what the time permits us. And once again, thanks a lot. And I have to tell you, sir, there have been so many messages for you, which says that, for example, thank you so much, sir, for this clear and informative presentation. Very informative presentation. Many thanks. Such a nice informative presentation. I'm just reading from the top of it. It's an excellent presentation, sir. I mean, there's so many. Thank you. Very informative presentation, sir. Thank you for your presentation, sir. You know, there's so many messages for you, and we are really, really thankful for you having spared your time for us. Well, we are short on time, so I'll just now request Dr. Bhojne, sir, to give his concluding remarks, sir. So give me a moment. I'll get Dr. Bhojne, sir, online, sir.
Well, I would like to say, I hope I can visit India again in the near future when things calm down health-wise, and I look forward to meeting many of you. It's the one regret I have is that I haven't been not being able to interact with folks.
It would be an honor, sir. I'm pretty sure Dr. Dhoot will find out a way to have a meeting, and we all are really looking forward to it, sir. Okay, sir. I'll just get Dr. Bhojne, sir, here for the concluding remarks.
Good evening, all. No duty is more urgent than that of returning thanks. I, Dr. Gautam Bhojne, Co-organizing Secretary, deem it a great honor to propose the vote of thanks to all who have helped us in making this international wildlife webinar such a resounding success. I feel honored to express our profound gratitude to Colonel Dr. Professor A.M. Paturkar, Honorable Vice Chancellor, Maharashtra Animal Fishery Science University, Nagpur, for valuable guidance, constant encouragement, and eminent advice for the organization of this international wildlife webinar. Sir's commitment to motivate us and work under such difficult circumstances is commendable. Sir is a true inspiration for all of us, and we are grateful to him. A million thanks to our distinguished orator, the phenomenal Dr. Edward Ramsay, Professor, College of Veterinary Medicine, University of Tennessee, Knoxville, U.S.A. On behalf of the organizers, I take this opportunity to wholeheartedly thank and congratulate him for his wonderful presentation. The way he explained the topic is outstanding. Although he is a man with white beard, but surely has a heart of a tiger. Today, you have inspired many young minds to take up wildlife as a career option. Besides the critical situation in the US due to COVID-19, the amount of risk and efforts he has put in to make this event a grand success is surely commendable. Our best wishes for all your future endeavors, sir. I must say that we are all inspired by your enormous work, sir. Thank you once again. I would like to propose hearty vote of thanks to our beloved Dean, Dr. A.P. Somkuwar, Nagpur Veterinary College, Nagpur, for supervising us with his vision, his extraordinary abilities, and leadership to guide us in this difficult time, and for being always our backbone in our endeavor and for his constant inspiration. I wish to express my sincere gratitude to the respectful Dr. D.S. Nauriyal, President, Indian Society for Veterinary Medicine, for providing encouragement and support and giving us an opportunity to organize this event. I would also like to thank Dr. R. Ramprabhu, General Secretary, Indian Society for Veterinary Medicine, for his moral support and guidance. I extend my sincere thanks to University Librarian Sri Sunil Gavandeji for providing all the necessary facilities for smooth conduct of this webinar. The word falls short to owe a great deal to our colleague, Dr. Arvind Chauhan and Dr. Shalaka Salvekar for the tireless contribution they have made, and I admit that the webinar could not have been possible in such a short span without their help. And a warm and special thanks I would like to convey for our beloved Dr. V.M. Dhoot, Head, Department of Veterinary Medicine, and the organizer of today's event for his vision and commitment to work and its execution with huge efforts and constant dedication for completing this webinar with the huge success. I want to share my views with you that an event like this cannot happen overnight. The wheels start rolling weeks ago. It requires planning and a bird's eye for details. We have been fortunate enough to be backed by a team of very motivated and dedicated colleagues of our department who know their job and are result-oriented. Behind every successful event lie the manifold attempts of our committed faculty of the Organizing Committee. I would like to take a moment to acknowledge the immense contribution of our dedicated faculty from Nagpur Veterinary College, Nagpur. Deep sense of appreciation and thanks to all the dear participants who choose to be with us and attended the webinar. Finally, I am overwhelmed to see a gathering of 1,617 those who have registered for this international webinar. Due to overwhelming response, the more time may require to deliver the participation certificate. So please bear with us. I thank one and all for being a part of this knowledge sharing fest. Thank you for sparing your valuable time. Looking forward for more such meets. Stay tuned. Have a great evening. And in the last, with the Indian tradition, I must say, on behalf of my team, namaste.